for pound whatever the public decides to donate, starting with at least £20 million to the National Emergencies Trust appeal. 2 short weeks ago, I spoke of the need for kindness, decency, and the sort of neighbourliness that is at the heart of these charitable and community efforts. The normally invisible connections between us have, in recent weeks, become more apparent. For most of us, we spend our lives oblivious to these connections, these bonds, and how our behaviours, however small, can have a dramatic effect on others. But these bonds are not invisible for our local charities. For the volunteer keeping victims of domestic violence safe. For the outreach worker helping a rough sleeper find a bed. Or for the support worker manning the phones to help stave off the heart-wrenching loneliness so many of our elderly relatives and friends will be experiencing right now. These connections might be hard to see, but they are there, and they are strengthened by our compassion for others. Charities embody this like no other organisation. And their lesson is that the simplest acts have the potential to change lives. At this time, when many are hurting and tired and confined, we need the gentleness of charities in our lives. It gives us hope. It makes us stronger. And it reminds us we depend on each other. Thank you. If we could now take some questions, I believe. Angela, were you going to present your slides first?
If I may.
Perfect.
I wanted to start by showing this data, which is a record of how much we've acted together to reduce how much we contact each other. So what's shown here is footfall at 17 stations across the country, counting how many people pass through those stations at different times through the month of March. And what you see is that at the end of March, footfall was down 94% compared to the first week of March. And in the next slide, what you can see is that that has worked in the sense that this count of new cases in the UK, day by day, over the last few weeks, is not accelerating out of control. Yesterday, there were 5,492 new cases, and the spread of this virus is not accelerating, and that is good news. If I could have the next slide, please. What's recorded here is people in hospital beds with COVID. And the highest of those lines is London, and the one just below in grey is the Midlands. And what this is a slower responding record of new infections, because of course once people are in hospital, some of them will have to stay there for many days, some of them for some weeks. But again, what we see is that the rate at which this is rising is definitely getting slower, and it looks like we're beginning to get towards a flat curve there, which is of course what we've all wanted. Our overall aim has always been to make sure that everybody can have access to critical care if they need it. And that's what's shown on the next slide, is COVID patients in critical care. Back one, please. Can I go back one, please? No? Okay. This one here. Yes, thank you. And there we can see encouraging news that perhaps, at least in some parts of the country, this really has started to flatten. Across the country, in the last 24 hours, this has increased by just 4%. And again, that is good news because this is our most limiting resource at the moment. So finally, I have data on the sad statistic of people who have died from COVID. And this is an international comparison across different countries, showing how that number accumulates in different countries. And the UK is the dark blue line somewhere in the middle there. This data has long reporting lags, and even after the number of people in critical care stabilises or even maybe begins to fall, this number will rise because sometimes deaths are reported many, many days or even a week or so after, sadly, somebody has died. So we expect this number to keep rising even after the curve has flattened. Thank you, Chancellor.
Thank you. Steve, anything you wanted to add?
Well, maybe a word on charities. So in the NHS, we work very closely with our partners in the charitable section. And I know it's really important that not only we all support them during this difficult time, but it's also really important to recognise the support that they are giving everybody to help them through the time where we are asking people to stay at home and take the measures that we have indicated. I have the real privilege at NHS England of leading the cardiovascular, that's heart attacks and strokes strategy, and two charities I work very closely with, the British Heart Foundation and the Stroke Association. And I know they would want me to say today, to remind everybody that the NHS has worked night and day to surge capacity to manage coronavirus, but it is also there for you if you have symptoms of a stroke, symptoms of a heart attack. Indeed, if you have any emergency condition, whether it's a sick child, whether it's a mother or a pregnant mother in pregnancy who's worried about the movements of the baby, you should be seeking emergency services, just as you always have done. They are there for you, and although we are focusing on coronavirus, it's important that we also continue to focus on other emergency conditions.
Thank you, Steve. If we take some questions, I think first up is Laura Kuhnsberg from BBC.
Thank you, Chancellor. You keep saying whatever it takes to help people through this time and with support from the economy. But do you accept, Chancellor, that under the lockdown there is a trade-off between protecting people's health and protecting people's jobs?
Thanks, Laura. Well, I think we've been clear. Our priority is to protect people's lives, their health and well-being. That is our absolute overriding priority. But alongside that, in a coordinated, I think, coherent and consistent fashion, we have also put in place unprecedented and significant measures to protect people's jobs, their incomes, their livelihoods, and indeed the businesses that employ them. I think that's the right approach. And what it does is means that we can mitigate as much of the economic impact as possible and ensure that as soon as we can get through this, that we can bounce back as quickly as possible. Was there anything you wanted to follow up on for either of anyone else?
I mean, do you accept, though, that some people are falling through the cracks? I mean, the Treasury Select Committee this afternoon has said that you need to take urgent action for some people who aren't covered by your very extensive scheme. Do you think the public should be prepared for a serious downturn, maybe even a recession?
I think I've been very clear and very honest that this will have a significant impact on our economy. That's not uncommon with every other major country that's grappling with this. I think we will all see a significant impact on our economy. And I've also been very honest that in spite of what are unprecedented measures in scale and scope, I can't stand here and say that I can save every single job, protect every single business, or indeed every single charity, the focus of today's announcements. That's just simply not possible. But what we can do is put in place what I think is an enormous amount of support in a targeted fashion as best as possible to help as many people as possible get through this so that, as I said, we can emerge on the other side of it stronger, united, and hopefully able to bounce back as quickly as possible. Perfect. I think if we turn next to, is it Tom Clark from ITV? Tom, are you there?
Hello, yes I am. Thank you, Chancellor. My question relates to testing. Yesterday's briefing, the Chief Medical Officer made the honest admission that Germany's lower death toll in their pandemic is due to their ability to test more people more quickly. Given their death toll is three times lower than ours, is it now time for the government to come out and admit that thousands of people have died and thousands more people will die in this country as a result of our failure to test more people more rapidly?
To be honest, I don't think that's what the Chief Medical Officer did say. I think he said that testing was one of many factors, and I think the Chief Scientific Advisor spoke about this too, was one of a range of things in Germany, and I think it's difficult at this stage to say what range of factors has contributed to what. I think the Chief Medical Officer was also making clear that it's important that all countries learn from each other. And I've no doubt that other countries will want to learn from our experience and some of the things that we have done in the United Kingdom, for instance, the work on modelling and predicting what the epidemic might do. So I think the point he was making yesterday was that everybody should be learning from each other, and indeed that is what we're doing. Angela might have more to say on that.
Yes, I would have thought the point would be that the rate of deaths, of course, appears much lower if you can count many, many more of the cases. That's certainly one of the things that you see. If you see different case fatality rates in countries, that could be because you're counting many, many more